Good morning and welcome to today's EEO Lunch and Learn session. Today we will be discussing the Executive Order number 82, Promoting Health and Wellness by Clarifying Protections Afforded to Pregnant State Employees. Our speaker for today is Beth Messersmith, North Carolina Senior Director for MomsRising.org. And before we begin our session today, as we always do, I would like to go over a little housekeeping with everyone. If you have any questions, please submit all of your questions to the chat. We are going to conduct our session today and we're going to record it and it will be available on demand, and I will send an email out about that. But we are going to have our speaker come and do her presentation. But if you have any questions throughout this presentation, please submit all of your questions to the chat and leave your microphones on mute so that we can hear today's speaker. And Ms. Messersmith will discuss how simple accommodations can provide maternal and infant health well outcomes and increase labor force retention. She will also be referencing other family-friendly workplace policies that encourage work-life balance. So as we celebrate the order's third anniversary on today, we'll also reflect on how it supports pregnant state government employees, promotes physical, mental, and family health, and helps North Carolina recruit and retain a talented workforce. And again, our speaker today is Beth Messersmith. Beth Messersmith is the North Carolina Senior Director for MomsRising.org, an online and on-the-ground multicultural organization of more than 1 million members and over 100 aligned organizations working to increase family economic security and end discrimination against women and mothers, and to build a nation where both businesses and families can thrive. In her role as campaign director, she leads the efforts of Moms Rising's more than 47,000 North Carolina members, drawn all from 100 North Carolina counties. She serves as the co-chair of the North Carolina Families Care Coalition and on the executive committee of the Think Babies Coalition and on the steering committees for several statewide organizations. It is my pleasure to present to you our panelists this morning, Beth Messersmith. I'm going to pass the globe on to you, Beth, and update your information before we move on. Hold on one moment.
Sure.
Is your presentation, and I am also going to
Great. Thank you. Thank you, Wendy. Thanks so much for the introduction. I have to say I was really excited and surprised to be given the opportunity to come today and celebrate with you all, because the day we learned that Governor Cooper was signing an executive order was a really exciting day for me, for Moms Rising's North Carolina members, because we know, we hear, we experience why these policies are so incredibly needed, and it was a huge day for us. And so to think back and think that's been 3 years ago, pandemic time is certainly different. But just to think how many state employees, how many pregnant workers' lives could have been touched by this in these last 3 years, what kind of difference this policy has had the potential to make in terms of maternal health care, child health care, long-term outcomes, supporting women in the workforce, so many different things that I come today with a real spirit of celebration and gratitude, because the reality is that policies like these do make a difference. They do change lives. They do change trajectories for families. And it makes a big deal, a big difference. So it was Moms Rising. So it was my great privilege to work with Governor Cooper and his team in crafting this executive order. As Wendy said, it was aimed around both increasing and improving health and well-being, increasing family economic security, and supporting women's labor force participation. At the time that this executive order was signed, a recent report had come out from the North Carolina Council for Women talking about the fact that even at that time, pre-pandemic, we were seeing women's labor force participation declining. And part of that here in North Carolina. And part of that was because of the barriers that women were experiencing in the workforce that was giving them the choice of staying in the job and perhaps having an impact on their health or their family, or leaving the job that they needed and needed to support their family's economic security. And so it was really exciting to see Governor Cooper. I heard him speak on this at a Women's Equality Day in August 2017, and then to see him moving rapidly to create, this was the first of a series of 4 executive orders that Governor Cooper signed starting in December 6th of 2018 to really support women's labor force participation and health outcomes for families. So for folks who aren't familiar with this one, the purpose, the stated purpose in the executive order of Executive Order 82 was to extend workplace protections and modifications to pregnant state agency employees upon request, unless doing so would create an undue burden or cost for the agency. So when we talk about workplace accommodations, what are we talking about? For the most part, what we're talking about is really simple things that can have a major impact on a pregnancy and the health of carrying that pregnancy to term. It can include things like the ability to have a water bottle to prevent UTI occurrences. It can mean if you have a job that involves a lot of standing, having the opportunity to sit on a stool perhaps. It involves, if you have a job that requires protective equipment, making sure that you have a vest or whatever gear you need that is large enough to protect the developing child. So lots of different small pieces. It may mean once the child is born, having access to express breast milk so that parents can meet their breastfeeding goals. And so we're not talking about things that involve massive changes. We're talking about small accommodations that can be as simple as a water bottle or a stool, but that really do have a big impact on the well-being of the baby and of the mom. And so why does this matter? Here in North Carolina, despite a lot of concerted efforts for many years, we still rank 38th in the country, worst in the country, in terms of infant mortality. We also know that we have significant racial disparities within that number. Birth rate or infant mortality rates among particularly the Black community are unacceptably high in North Carolina, tragically high. And we know that 2/3 of all child deaths in North Carolina are to infants under 1 year. When we look at what the leading causes of those deaths are, they are premature birth, low birth weight, and maternal health complications that are related to the mother's health during the pregnancy. And so we look at what can we do to change that. Let's go to the next slide. North Carolina, the March of Dimes puts out a report card every year. This one is from 2021. We got a D. Our preterm birth rate is 10.8%. It's one of the highest in the country. Again, the preterm birth disparities in North Carolina, the preterm birth rate among Black women is 48% higher than the rate among all other women. And we rank in the bottom of the nation for preterm births. And we know that these have high costs. They cost, on average, $64,000 for every preterm birth. The baby that you see on this particular slide is my son. 16.5 years ago, I had severe preeclampsia. I went into the hospital at 28 weeks. He was born at 31 weeks, almost a little over 2 months early. He spent several months in the hospital. He only weighed 2 pounds. Just for his birth alone was $140,000 for me, $130,000 for me, $140,000 for my son. That would have bankrupted my family if we didn't have access to insurance. And so when we have these preterm births that we're talking about, there's an emotional impact, there's a healthcare impact, and there's also a financial impact on the state. And we know that when we talk about preterm birth, every single day that a child stays in the womb is a day that they're closer to not having long-term outcomes, because it's not just the cost of the birth. When we have preterm birth, we're also talking about things like needing speech therapy, needing occupational therapy, needing feeding therapy, maybe having long-term health needs that will cost over the life of the person. And so we really are talking about what can we do to affect that beforehand. And the reality is that it can make a difference. We talk about low birth weight. Some of the things that can lead to preterm birth and low birth weight are related to being in the workforce. So when we talk about the social determinants of health, we know that pregnant people don't exist in a bubble, right? They exist within a context that includes, family stress. It may include the type of work that they do, their health pre-existing the pregnancy. And so we look at how can we move the needle in each of those areas. And the reality is that there are things that we can do within the workplace to help support people in having healthy pregnancies and healthy outcomes. We also know that one of the social determinants of health is stress. And when folks are in a position where they feel as though they, because they have a health need related to their pregnancy, and they have a fear that if they raise the need for that to be addressed in the workforce, that they risk the job and the money that their family needs and counts on, that also creates just another added layer of risk and stress for health outcomes. And so really, as we talk about pregnancy accommodations, it is about helping keep people attached to the workforce so that they don't have to make those decisions about choosing between their health and their child's health and their job, but also really changing through, like I said, water bottles and stools, really changing the outcomes for folks. And why does this make such a big difference? The reality is that North Carolina needs women in the workforce, and the majority of mothers are already in the workforce. Two-thirds of moms with children under 6 in the U.S. are in the labor force. 3/4 of moms with children under 18 are in the labor force. And moms are important in many cases as the sole or primary breadwinner for their families or the co-breadwinner for their families. So when people are making these choices about their health and their jobs, they're not decisions that they are making lightly. I've heard from mothers who have had to make the decision about whether to leave a job that would not accommodate them or would not help them do the simple things that they needed to stay safe during this period of their lives. And it's heartrending to hear those stories and to know that that through simple changes that could have been avoided, and that person could have stayed in the job that they needed, and in many cases that they loved. So when we talk about broader pregnant workers, about 1.6% of the North Carolina workforce gives birth in any given year. 1 in 5 pregnant workers are employed in low-wage jobs, which are more likely to be physically demanding. And also we know that women of color are disproportionately represented amongst low-wage workers and in physically demanding labor, which correlates with what we see in terms of the health disparities of infant mortality, preterm birth, and low birth weight. The vast majority of pregnant workers will never need accommodations, or they'll need minor ones in order to stay healthy. But for those who do, they make a tremendous difference. The American College of Obstetrics and Gynecologists issued an opinion highlighting the importance of these accommodations in keeping pregnancy safe. What are the things that this can address? Everything from miscarriage to low birth weight, dehydration, amniotic fluid issues, urinary tract infections, preeclampsia like I suffered. There's a whole host of pregnancy-related complications that can be avoided through simple workplace accommodations. When Kentucky was looking at they've passed a statewide pregnant workers accommodations policy for every worker in their state. And when they were looking at doing that, the Louisville Department of Public Health put together some flow charts that showed what is the direct impact of, for example, an experience a worker might have. What does it do to the health determinant, and how does it change the health outcomes? I'm not going to walk you all through all of these, but I think that it's worth noting just the simple changes. So for example, the change in standing requirements, the use of the stool, reducing the pressure of having to stand all day long, can reduce pain and risk of preterm birth. Access to water, as I spoke about earlier, it can make a difference in amniotic fluid. It can make a difference in blood pressure, which is linked to preeclampsia, UTIs. Hearing from folks with exposure to chemicals about, that can reduce the risk of miscarriage. And as I talked about earlier, the real stress of the ability to maintain employment, to be able to care for their existing children that they already have, and not having to feel like they're having to choose between the job they need and their health and safety and that of their family, can make a big difference, especially for something like preeclampsia that is directly related to blood pressure. We also know that it makes a tremendous difference in terms of support for breastfeeding and the benefits for moms and kids. And I want to make sure I'm flipping through my notes here because I want to make sure I get these stats right because they always shock me. So 4 out of 5 U.S. moms start out breastfeeding, but only 1/3 of those are still breastfeeding at 6 months, despite the fact that all the medical experts and the medical data indicates or encourages breastfeeding for a year or for at least 6 months following birth. 3 months after giving birth, more than half of U.S. women who worked during pregnancy have returned to work. And according to the Department of Labor, 1 in 4 moms are back at work within 2 weeks of giving birth. We know that the reality is that most folks in the U.S., most workers in the U.S. don't have access to paid leave, paid parental leave to welcome a new child. Nationwide, that number is only 21%. Here in North Carolina, according to a Duke Center for Child and Family Policy study that happened in 2019, right, not long before the pandemic started, only 12% of workers here had access to paid leave to welcome a new child. And so when there isn't that time to establish work or establish breastfeeding, and there isn't an opportunity in terms of time and a place to pump, to express breast milk in the workplace, it does make a tremendous difference in whether that's even a possibility for folks. And we know that this is even more true for low-wage workers. So what we've seen is that across the country, a number of states have started moving to provide pregnant worker accommodations. And there's some question about why is this the case? Why do we need to be talking about it at the state level? Don't we have federal laws that talk about that? And what years of litigation have shown us is that the Pregnancy Discrimination Act that was passed back in 1978 talked mostly about the right not to be discriminated against, right? And also in the Americans with Disabilities Act, there were some requirements there that employers make reasonable accommodations for employees with disabilities. But between these two laws, there's a gray area. And what the courts have determined is that these existing federal laws do not require employers to guarantee pregnancy accommodations. And so states have started to step into that void. While we find that most employers honor requests, one report estimated that 250,000 pregnant workers are denied their request for accommodations each year. And that doesn't even count the many employers or employees who don't ask for those accommodations because they're afraid of losing their jobs. And so what we've seen is, I said, states starting to step in to fill this void. There we go. As of November 2021, we had 30 states and 5 cities that have passed these kinds of supports for pregnant workers with strong bipartisan support, frequently, sometimes unanimous. And those have included southern states. We've seen South Carolina pass unanimously. I think that was in 2019. Kentucky, Louisiana, West Virginia. In 2020, Virginia passed pregnant worker accommodations for every worker in the state with strong bipartisan support. And Tennessee did in the fall of 2020 with unanimous bipartisan support. In their legislature. So what we've seen here in North Carolina is Governor Cooper leading the way in terms of trying to provide pregnancy accommodations for workers, at least those under his purview within state agencies. And Executive Order 82 was the first step in making sure that that happened. Bills to provide these accommodations to all North Carolina workers, like we've seen in all of our neighboring states, have been filed in 2019 and 2021, but neither time have they advanced. Pregnant worker accommodations have also been endorsed by the Child Fatality Task Force in 2020 and 21, or 2019 and 2021 as well. We're also seeing federal momentum around these issues. Both last year and this year, the House passed the Pregnant Worker Fairness Act that is explicitly providing these kinds of accommodations to all workers in all 50 states. And that bill, when it was considered in the U.S. House, had the support of a large number of business groups who want to see, instead of state-by-state decision-making, see a uniform kind of federal approach to making sure that pregnant workers have the accommodations they need and not a patchwork approach to this. But the reality is that North Carolina workers really can't afford to wait for federal action. It's pending in the Senate. We very much hope, and we're hearing indications that there's strong bipartisan support for that as well. It's been kind of delayed in getting on the calendar, given everything else that Congress has been considering lately. But in the meantime, pregnant workers are dealing with these issues every single day. Pregnant workers And you don't have a lot of time. That window is short, and the ability to make a difference and really have an impact is small. And so we need to make sure that as many people have access to benefit from these accommodations as possible. As I mentioned earlier, there's strong support from a lot of different sectors. It's been included in the Child Fatality Task Force Plan, the North Carolina Perinatal Strategic Plan, the Early Childhood Action Plan. There's a lot of evidence that that points to the medical value of these. And so we're seeing that reflected from a lot of different stakeholders involved here in North Carolina. And just oftentimes we don't lift up the ability of administrative policies to really change lives. And this is one of those cases where through this executive order, lives are being changed for workers, lives are being changed for babies, possibly for their entire lives. It really is something that makes sense. It makes economic sense. It makes, it's just a very humane approach to making sure that folks can be, productive, helpful employees while at work, and also not have to choose between their health and safety. And so when we talk about the ability to really make this happen, pregnant workers have to know that they have access to these accommodations if they request them through their employers. And this is where human resource professionals really are an important lifeline, a critical partner in making sure that folks know what rights they have, what opportunities they have. And so for those of you who are on the call today who work in human resources and have been working to get the word out on why pregnancy accommodations are so critical for families, I just want to say thank you on behalf of all the families that I work with. Oftentimes folks don't know what their rights are, and having someone who is being out there making sure people know what they're eligible for, making sure that people have access to what they need is tremendously helpful. So I just wanted to give you a lot of gratitude for that. And I did want to share a little bit about the other executive orders that Governor Cooper passed in this series. As I said, all of these kind of came out of a conversation around how can we support women in the labor force. Women's labor force participation is so critical. Women bring so many skill sets to the workforce, and losing that, especially when it's avoidable, is really unfortunate. And so pregnancy accommodations came first, and the second one that was in December. And then on April 2nd of 2019, we saw Governor Cooper pass Executive Order 93, which banned the use of salary history in the hiring process, state hiring process. And when we talk about why this is important, salary history is one of those very tangible things that we know is tied to closing the wage gap. Because if you're using salary history and future hiring decisions and salary decisions are based on that salary history, having a unnecessarily low starting point can follow you your entire career, costing folks thousands and thousands of dollars. And when we're talking about this from a mother's lens, when we know that so many North Carolina moms are the primary or sole breadwinner for their families, that has tremendous impacts on children and children's opportunities in lifting families out of poverty. So we were really excited to see Governor Cooper's leadership here and his example setting in saying that we're going to ban the use of salary history in hiring in the state. And I just wanted to point out the pictures that are here. I was out with a number of other advocates with moms. You could actually see, I think, my kids in this picture. And we had a bunch of Krispy Kreme donuts out on the back of the portico at the General Assembly, passing them out, talking about equal pay day, having coffee to talk about equal pay day, when I got a call from Governor Cooper's office letting me know that this was going to be happening. And it really is such, I can't overstate what a big difference this makes for families, and how many people I've heard from that really benefited from this. The next one I wanted to lift up is, this one is an executive order, but Governor Cooper passed an executive directive allowing safe days. And I don't know if folks have heard of safe days before, but safe days are a concept that says if you're a person who is experiencing domestic violence, stalking, or who's been a victim of sexual assault, that you should be able to use your sick days or other paid leave time that you have available to deal with the impacts of that. Whether that is that you need to go to court. Here in North Carolina, we have, you can get time off, you're guaranteed under law time off to go and seek under 50B, to seek a protective order. but you are not guaranteed time off to go back to court if your protective order has been violated. When I've heard from families who've needed to move from unsafe situations and are afraid to take the time or able to take the time to move because that would put at risk their job. And similar to, we know with pregnancy accommodations that, having a baby is one of the greatest risks in terms of not having family economic security, because without access to paid leave, folks, you have new expenses coming in when you have a new baby, and then you have to often take unpaid time off to welcome that new child to your family, making that a difficult time when often families may dip into poverty. Similarly, when you're leaving a domestic violence situation in particular, that's a very financially risky time. Folks need to be able to have financial resources to get themselves and their children into safer spaces. And so by Governor Cooper signing this executive directive saying that all these sick days can be used as safe days, it made a tremendous difference. And you can see in this picture, we have folks from the Coalition Against Sexual Assault, we have the Domestic Violence Coalition, the Council for Women, and also a state employee who experienced domestic violence while working for the state, and was able to share directly with Governor Cooper what a difference having these safe days would have made for her in that situation. And so it gives me a lot of pause to think about what a tremendous difference, again, just the simple executive directive is making in people's lives and their ability to keep themselves and their children safe. And this picture, Executive Order 95, I'm sure many of you all are familiar with this. Executive Order 95 provided paid parental leave of up to 8 weeks for state employees of existing agencies or of state agencies under his purview to welcome a new child, whether that's through birth, fostering, or adoption. And you can see the signing ceremony, Governor Cooper surrounded by state employees. There were a number of members of the Highway Patrol there who spoke. This was a really emotional day for me. Just to share my own personal story, as I mentioned, my son was in the NICU. I was in a situation where at that time I was able to leave my job, my full-time job, to be at the NICU with my son, because all the medical research indicates that having a parent there's something called kangaroo care, where they lay the child on your skin. They say that if the baby is too small, and being able to hear your voice while they're in the incubator is incredibly important for developmental delays. The children have much better health outcomes. They come home from the NICU earlier. And the reality is that when my son was there for 2 months, most days I was the only parent in the NICU. For much of the time he was there, my son was the only white baby in the NICU, because we know that there are health disparities that lead to preterm birth. And we saw that in the data earlier. And I made a lot of promises sitting by my son's bed about how important it would be to work to provide other families with access to paid leave. So seeing Governor Cooper pass this executive order, knowing personally what a huge, tremendous difference this is going to make in terms of families' lives. And I'm sure that many of you all who work for state agencies have heard that. Governor Cooper's executive order started kind of a trickle, or not a trickle, actually a big stream of seeing other Council of State agencies adopt this, the UNC Board of Governors adopting it for the UNC system. And as a result, thousands and thousands of families being able to share those moments that you never get a do-over on. And there's lots of health and emotional bonding, social bonding experiences that come from having that parental leave possibility. And so, there's so much work that's happened as a result of this series of executive orders. It has made a tremendous difference in families' lives, and there's so much to celebrate in that. And there's still work to be done, because as grateful as I am to Governor Cooper for making sure that state employees have access to these, the reality is that all North Carolina workers and families need these. No North Carolina employees should be in a situation where they're having to choose between their own health and safety, the health and safety of their children, and the jobs that they frankly need. And when they do have to make that choice, we all lose, right? Because our economy loses, our labor force loses, and our families lose. And so there's there's a lot of progress to be made here, and I'm so incredibly grateful to Governor Cooper and his team and the Office of State Human Resources. If you all haven't looked at it, they put out a tremendous report lifting up the impact of the paid parental leave policy here. And I don't have it, but I can try to find it to put in the chat. But if you haven't looked at that and read the stories of families who've been directly impacted, you should do that. But there is work that remains to be done. And hopefully we'll see more progress on all of these issues at the state level, at the federal level, and that we'll keep working until we can ensure that all North Carolina workers and employers have access to these kinds of policies and the support that they need for everyone to thrive, both the employee and the employer. I'd be glad to take any questions that folks have. This work is tremendously important to me professionally as well as personally. So if there's any questions people have, I'd be glad to answer them.
One initial question come in, and you were speaking about some legislation that provided pregnancy accommodations for women, and they wanted to know if you were referring to HR 2694.
Probably so. I have to be honest with you, there's so many numbers. Is that the Pregnant Workers Fairness Act?
It looks as if it is that, or
Okay.
very close to it,
Right.
because I was doing some research as well. So
Okay.
I just wanted to put that question out there. And my second question is, you were talking about, all that we are doing to support pregnant employees within the state of North Carolina as an employer. And our group here is primarily, again, HR professionals. What could we continue to do to support our pregnant employees? Could you elaborate a little more on that so that we can get some more insight from you as to what we can continue to do to support our pregnant employees?
Absolutely. I mean, I think that the real thing is the biggest thing is knowledge is power, right? And I hear from so many moms. I get emails almost every day with folks who have questions, and you know, and who are maybe sometimes are scared to approach HR because they're worried that raising questions, raising any concerns might be a reason that they would lose their job. This was particularly true before the labor market that we're in right now, but people are wary, especially related to pregnancy, that if you talk about your pregnancy, then you're opening yourself up to termination. And so I think that when HR professionals can help create a culture that that doesn't make becoming pregnant be seen as a liability, but really as a time limited portion of an employee's life with the employer. And that this is one of those things that I mentioned earlier with pregnancy accommodations. We're talking about most people won't actually need them, but for those who do, it makes a tremendous difference. But I think that people, when we talked about earlier the study that said 250,000 folks had their pregnancy accommodation requests denied, and many more probably never worked up the courage to even ask for them. And so this is one of those places where HR professionals really can be heroes and sheroes in making sure that folks know what their rights are and making it not feel dangerous to actually use those. I think that one of the things we hear oftentimes with paid leave, and especially as it pertains to fathers, is that we hear from dads who worry about, yes, I may technically have access to paid leave, but if I use it, like, what is that going to be? What is the long-term impact of that going to be on my career? And so I think, to the extent that HR professionals can just normalize that, yes, we have these policies and we want you to use them because your health and well-being matters to us. When I hear from moms, they say, especially those who got to access these kinds of supports, they say, you know what? I liked where I worked before. I'm loyal to them now because they were there for me when I needed them. And I'm not going anywhere. And I think that pays off for the employer as well. Is there another question it looked like? I guess maybe I should also finish giving you the update on the Pregnant Worker Fairness Act. That is the main, and actually at this point, I think that's the only vehicle that's moving in terms of pregnancy accommodations at the federal level. It does have bipartisan support. We expect it to be heard hopefully any day now. Uh, it's competing with the Build Back Better initiative. Um, at the state level, the bill was called the Healthy Pregnancy Act. And that one, because it did not pass crossover, wouldn't be back up in this legislative biennium. So if it isn't addressed at the federal level before then, we're hoping to take another bite at the apple in 2023 here at the state level.
Yes, attached to Title VII in the ADA are these legislative actions having or potentially having?
So I think I'm going to be honest with you. I'm not a lawyer, so I'm going to preface what I say with that. But we do work with lawyers who do this sort of work across the country, and I think that what we found is that this decreases the gray area. I think that what we've seen, and the reason that this particular area has been subject to so much litigation, is that there's this gap that exists between what the Americans with Disabilities Act says, because pregnancy in and of itself is not a disability. It's some of the impacts that stem from that. The Pregnancy Discrimination Act is clear on the discrimination pieces, but doesn't really talk about filling these gaps of what a worker might need to stay attached to the workforce. And so that's why we've seen this kind of insurgence of states trying to act to fill those gray areas. And there was some interesting articles that came out. There was one in the Upstate Business Journal when South Carolina passed theirs from business leaders talking about how much they appreciate the clarity that these laws provide, because folks, by and large, employers want to do the right thing by their employees. It's just a question of not necessarily knowing what the expectations of the law are. And so, in states that have passed it, what they've seen is that actually litigation costs have gone down, because all parties then know what's expected and required of an employer. And so, that's what we've heard, is that it really does make a tremendous difference. Because so many states are acting, there is this development of a bit of a patchwork system. North Carolina does not have a statewide policy, so we haven't really been part of that. But it's one of the reasons that there's a lot of business support for a federal approach that then will, across all states, standardize what these requirements are. Folks have other questions for me?
Yes, I do have another question for you.
Sure.
Any updates that we should be aware of regarding prospective pregnancy and COVID concerns? Like, are there any links to accommodation requests from that standpoint?
There have been some, and it's been one of the questions that we work with a group called A Better Balance that is a team of lawyers. They also staff a helpline where folks can call in when they have concerns about, I don't know how to approach this at my workplace, or I'm afraid to talk to my HR director. And, things that they have heard before is that folks, especially essential workers, there was a lot of concerns, especially before we had a vaccine, about folks being out, being exposed, and what the impacts of that on a pregnancy are. I don't know exactly how the states that have passed these pregnancy accommodations bills have handled, COVID-related requests. But I think that, part of that is being addressed broadly now, because we know that the vaccine is now available to pregnant folks. It is been proven to be safe in pregnant folks. And so I think that has kind of soothed some of those concerns, but especially early on, A Better Balance was hearing from pregnant people, especially in the healthcare field, essential workers, folks at grocery stores, who were very afraid about what that could do. And we're asking questions about, is it possible to request to be assigned to a different role as opposed to a frontline role during that time period? And those requests were dealt with differently in different states depending on what their requirements were. But I think that with the vaccines, that's less of an issue now than it was in those first few months. But we were hearing regularly from moms who were very concerned about, is it like, if I ask for example, if I'm a cashier at a grocery store and I ask to maybe become someone who stocks or who works back in the produce department behind the scenes, like, is by simply asking, am I putting my job at risk? And those are questions families have that I think are very legitimate. Are there any other questions, or I can give a quick update on Build Back Better, if that's helpful to people? Well, the one other piece I wanted to flag for you, which is exciting in terms of family-friendly workplace policies, is that the Build Back Better program or budget package that passed through the House included 4 weeks of paid family and medical leave. And this is a huge step forward. It's the first time that we've had any change in leave policies that's passed through a House of Congress since the FMLA passed back in the 90s. This package would provide 4 weeks of paid family and medical leave for a range of caregiving needs that reflects those in the Family Medical Leave Act. So welcoming a new child, caring for a seriously ill loved one, or covering for your own serious illness or injury would all be covered. It also would cover a wide range of workers, so to make sure that there was a possibility for folks who are self-employed, and for part-time workers not to be left out. It's really exciting. The United States is one of the only countries in the world that has no paid leave policy at all. We've seen 10 states in the District of Columbia who have passed paid leave programs in their states. And all the research on those policies shows that it has tremendous positive impacts for the employer or for the employee, and it has positive or neutral impacts on the employer. It decreases recruitment and retention costs, training costs, and it helps people stay attached to the workforce. It decreases the need of reliance on public assistance. It's helped, there have been studies in California that show that it has reduced shaken baby syndrome, because periods of strong economic stress can lead to child abuse. And so we've seen lots of positive impacts from the state programs, and so really excited about the possibility of this 4 weeks of paid family and medical leave being included in the Build Back Better proposal. We hear that the Senate will hopefully be voting on the Build Back Better by the end of the year, by the end of 2021. So we'll have more answers on what that looks like. I mean, I think from the OSHR report on what a difference it's already made for state employees here in North Carolina, we know that it will make a big difference in families' lives in those moments where none of us should have to choose between being a good family member and being a good employee. There are other questions?
Thank you so much for that. I did send to everyone the link for the report for paid parental leave. I sent that information out within the chat. And if you have a moment, I'm going to go over a couple of things with it, because it's all this information, it all ties into whether it's Executive Order 82, Executive Order 95, they all kind of tie and work together. But I found it to be extremely interesting and encouraging to see that we had over, let's see, 1,600 employees use 4 weeks of paid parental leave, and then over 2,000 employees use the 8 weeks of paid parental leave in 2020. So that was all very encouraging news to see that people were taking advantage of this type of leave. And then as well, and you hit on this a little bit, Beth, where we were talking about the men that use paid parental leave as well, because they're an integral part of the family, and are actively involved in the pregnancy as well, and want to be involved. And this is a great way for the fathers to be involved throughout the pregnancy, but then once the baby is born, this is all crucial again. So the males that use the leave it was 1,600 men that used the leave in 2020. And so I thought that was very encouraging to see that we did have those strong numbers by both genders using that leave and taking advantage of it.
I will say, again, kind of from a personal perspective, my husband didn't have access to paid paternity leave when my son was born. And literally, I was in bed on stroke watch, on stroke medicine, and our son was in the NICU, not sure he was going to survive. And my husband was back at work because he had only been in the job a year and a half, and he was afraid he was going to lose his job. And so it's one of those situations where, making sure that fathers can be an active part. There's also a lot of research that talks about when there is that time for bonding early on, it increases paternal involvement throughout the child's life.
That is very true. And I was so encouraged when this leave came about. And I was like you, Beth, where I did not have the opportunity to use this leave, but just to know that state employees in the future, if they need to use this leave, just knowing that they do have this as something that they can use, and it helps with their family and the bonding and that whole part of the process. I was strongly encouraged by that. And I apologize for the link that I sent to you. It did not work, but we did get another link, and that link is there. I am also going to make sure that I send this link out when we have the on-demand portion of our program posted. So I will make sure that everyone is able to see a copy of that. I'm looking now to see if there's any more activity from the chat. Lisa, are you seeing any activity?
No, not at this time. I think it's
Okay. Well, we are going to go on with maybe another couple of questions here. If you just give me a moment here. Beth, I'm looking at this report again, and it's all some great information. And I wanted you to know as well that as EEO officers, that we do report information on Executive Order 82, and we talk about pregnancy accommodations within our EEO plans. So it's all a part of things that we're doing to, again, encourage pregnant workers to seek accommodation if they need it during their pregnancy. But I wanted to get something from you as well about the, you talked about it a little bit, but as far as lactation policies, are you seeing the impact of that in the workplace, or when you have workers that are, I guess, in situations where they do not have access to those lactation rooms? Can you just expand on that a little bit? And I do want you to know that we do have a lactation policy here as well with the state of North Carolina. And I just want to hear your thoughts on having a lactation policy to support employees when they return to work.
Yes, yes, I so appreciate you bringing that up. Having a lactation policy is incredibly important, and we hear from, no, I do hear from folks all across the state. My colleague Tina Sherman, who works on breastfeeding for us, she sits on the National Committee on Breastfeeding, and it is so heartbreaking to hear moms who struggle to establish their milk supply, who really want to be able to provide that, especially for folks who, may have a preemie or have had a micro preemie. We know that that really makes a huge difference for their health outcomes. But then, after they've established that milk supply, they don't have the ability to express milk at work. And it's heartbreaking. And so, we're really excited to see, the state agencies moving, making sure that that's a possibility here. North Carolina does not have a state level policy that guarantees this for all workers. Many workers are covered under the breastfeeding provisions of the Affordable Care Act, but not all. And so there's been an effort at the federal level to close that loophole. Just a couple of weeks ago, something called the Pump Act passed, which would make sure that all workers, regardless of where they work or how they're classified, have access to these kinds of lactation rights. And so again, the Pump Act is one that hasn't been heard yet in the Senate. It did have, strong bipartisan support. It's one that, Congresswoman Adams has also helped champion as part of her efforts around maternal mortality and infant mortality. But we're hoping that we'll see the Pump Act pass through the Senate soon. But there is disparities, and I do hear from folks, and again, it's that kind of for lactating employees who really want these rights but are afraid to rock the boat, right? Because they know if, for example, they had sick days but no paid leave time, they've probably used up a lot of their sick days. They don't want to rock the boat there. They know that they don't want to be seen as making undue requests. And that means that oftentimes they suffer and their child doesn't get what they would really like to be able to provide for them. And so I'm grateful to all the state agencies making sure that North Carolina state workers have access to that. The other thing I would lift up, which I know is not exactly an HR piece, but there is a place about creating welcoming environments for folks who come to state agencies. So for example, when someone needs to access social services, making sure that those environments are breastfeeding friendly for the clients as well, and that people feel comfortable, while they're waiting, while they're having these meetings, that if they need to breastfeed as well, that they have access to those kinds of spaces as well. I remember, especially early on when we started with Moms Rising, taking moms to the General Assembly on a regular basis, and folks would need a place to breastfeed or might need a place to express milk, and there really weren't those places available even at the General Assembly. And so I'm excited to see those changes happening, because it does impact accessibility for families as well. Are there other questions?
Final question, but I just wanted to say in conclusion that, again, I'm talking a little bit about Executive Order 95, but it all ties into Executive Order 82 as well. More than 3,600 state employees have used paid parental leave since the benefit became available, and the 19% increase in use from fiscal year 2020 to 2021, it reflects the increase of 10 months of data for the first report and a full year for the second. And here at OSHR, we're going to continue to market the benefit program proactively as a recruitment and retention tool that helps to make state government careers more competitive with private sector opportunities. And we will also continue to work closely with those participating agencies to ensure that employees are aware of paid parental leaves availability and provide support to those in need of submitting a request and accurately recording their time in doing so. But I also would like to just encourage all of you to just get these programs and these executive orders, get the word out about them to your pregnant employees, because again, they are all very effective recruitment and retention tools that we do have. And our main goal is to actively recruit, hire, and retain employees here at the state of North Carolina. And again, I would like to just thank you, Beth, for coming out and speaking with us today as we're observing the 3rd anniversary of Executive Order 82. And hopefully there will continue to be more initiatives that will encourage our pregnant employees and employees that are working on strengthening the family. So if there aren't any questions, and I do see one more, are there any flex benefits available, trainings available or scheduled for registration? Right now, I don't believe that there are any available, but I will get back to you on that. But I do see your question, and I'll get back to you on that privately. But I would again just like to encourage you in everything that you do with Moms Rising, and we appreciate your collaboration for Executive Order 82 and your participation in our session today.
Well, I appreciate you having me so much. It really is a very celebratory thing, and appreciate all of you all being here. I guess I have one request of the HR professionals on the phone, if that's okay.
Oh, yes.
So I know that there's a very strong network of HR professionals who work both within state government and also who work with local governments and in the private sector. And so to the extent you can, we've been working with local governments. There are now 22 local governments that have passed either paid parental leave policies or paid family leave policies, the most recent ones being Buncombe County and Asheville City. But there are 22 of all different sizes across the state. And we're trying to both go back to those folks and say, well, have you talked about safe days? Have you talked about pregnancy accommodations? And to continue to expand the number of local governments that are offering these benefits. And so I would just ask that when you have a chance to talk to your peers, your colleagues, that you mention these, because it is a way to amplify the effects of Executive Order 82 by letting them truly be a model for other places. Thank you.
Thank you so much, and we appreciate all of your insight, especially your personal experiences with everything, because it makes it all again so much of what we are looking for and need right now as far as employees are concerned. So again, we appreciate that and look forward to working with you in the future. And again, this session will be recorded. So if you're interested in seeing it, look out for a note from me that will remind you that this session will be available on demand. And until the next EEO officers virtual lunch and learn session, I'd like to say have a good and safe rest of your week. And you will look forward to hearing from me of other lunch and learn sessions that we have in the future. And again, thank you, and we will see you again.
Thank you.